Hi, Terence. Hello?
Yep, got you now.
Oh, right, okay. Yeah, your screen's just appearing. Okay, that's cool. So I've just had a quick look at in the way that I do. So do you want me just to give you a list of what I've seen, or?
You've already picked something up, have you?
Well, because what I basically do in my sort of hard to explain, in my kind of mind's eye, I basically connect to the energy of the person that is the subject, or client, if you like, and then I ask my guide to basically show me a picture of or display some sort of picture of what they see. So I tend to see, if you can imagine, I kind of see like a person that is, you know, like an outline of a person, a human, in white. Then I see things attached around the outside or things. So what I actually saw basically was a picture of like the client, subject, in white, and I could see two conscious energies connected to that picture. One was at the top of the neck, and the other one was at the bottom of the back.
Can I stop you just for a moment?
Yeah.
Can you verify that I haven't told you who this subject is yet?
Yes, I can, yeah.
So I've not given you any name, sex, gender, location, or nature of the problem. I've not given you anything at all.
Yeah, so this is just a first psychic preview, if you like, from my perspective.
So bearing in mind that this is a research project and academics and scientists are going to be reviewing this, they'll need to be able to work out or try to find some kind of method by which you know of the subject that we're talking about. So we'll leave that open for now, but all we need to determine at the moment is that I've not given you any information at all. You don't know who it is, but through some mechanism you have tapped into this person.
Yes, I find it hard to explain as well, really. I mean, for me it's really easy, because all I actually do is look at a picture in my mind, and the guide basically shows me the picture they want me to see. So I've got no idea whether that's right or wrong, or
so the
guide
knows who it is.
Yeah, so I never kind of need. So when I work with clients, I never kind of need like a photograph or hair or a dress or anything. I just basically through intent, really. The intent is to connect to a certain person, and that's the way that it tends to work.
So what we've established so far is that with no photograph, no name, no information from me, your guide is linking in to this person that I have in mind. Yeah.
Yes, yeah.
Okay, right. Having established that, let's now move on. You were describing to me what you saw.
Yeah, so basically I could see two conscious energies connected, one with a cord that connects into the back of the neck, and the other one with a cord that connects to the bottom of the sort of lower spine, sort of bottom of the back, basically.
Yeah.
So these two things, I mean, I call them negative energies because I see them as just basically negative energies, just blobs of negativity, but they're conscious in that it's not something that's just become attached and this person's carting around. It's something conscious that is actually attached to the subject, if you like, in a conscious way with intent to drain energy and to form some type of control.
Okay, well let me ask you this. Can you find out for me, with the help of your guide, when these negative energies first became attached to this person and under what circumstances? Is that possible?
Yeah, just ask me. Do you want me to give you a list of the other things that I saw at the same time?
Okay, yeah, go on.
It's only whilst I remember.
Yeah.
So the other thing was I could actually see something in the mouth. So the mouth appeared to be closed, or something's actually inside the mouth. So again, I see an energy. This isn't a being, if you like. This is some other form of energy that's been actually inserted into the mouth area, into the etheric, and that would control the type of communication that comes out of the mouth. So again, for me, it's quite a common thing to see.
Okay.
There's also something in the womb area, or down that lower area. Again, some type of energy that's negative would probably cause pain, and maybe that person would display different types of pains in that lower stomach womby area. Again, most probably the pain wouldn't be asserted to a physical problem. So it's the sort of thing that most of my clients that get pain, and I see things like this, they tend to go to the doctor and they can't actually find out, or there's no prescribed, there's no detailed problem per se. And from looking at the actual energetic field, the kind of age group was somewhere around mid-20s that I saw, so it wasn't an old person.
You're right there, she's 23.
Oh, right, okay. So what was I saying? What was I saying, mate?
You're talking about the energy causing pain in the sacral region, in the womb area.
The womb area. So yeah, and the other thing I could see is, again, this tends to be quite common. I'm not quite sure whether it's certain types of negative energies, but some of them seem to put almost like a helmet over people, and this helmet it looks to me like a normal helmet, but it's got side pieces that cover the ears, and it's kind of got like a different lens that covers the eyes. And what this tends to mean, especially for people that have got schizophrenia, is that the negative energies that are connected can control what the person hears and what they see. So if you were talking to someone that had this helmet on that I visualise and I see, what you say won't be what they hear. That information is tainted and it gets changed. And also what they then say out of their mouth verbally, if they were talking to you, almost gets changed before it comes out audibly into your own ears. So these helmets are some type of like controlling system that these negative energies use.
Because you've discovered quite a lot with this person. 1, 2, 3, 4 sources of problem, 5 altogether. Just to recap, you've got 2 energy forms where you started, one in the back of the neck, you said. These are at the higher level, interfering with intention. Yeah.
Yeah.
I need to find out if I can when they attached, when they...
Let me just ask my guide a minute then. So you're saying around the age of 18?
Okay. You may be interested to know that this client told me that she was diagnosed at the age of 18.
Oh, right, okay. That's interesting.
But that is not to say that this was the start. And I don't want to put words in your mouth. We've got several different energies here that are working. The information you've given me so far about the person, the age, obviously the sex, you're spot on here. And you've given me an explanation for the cause of schizophrenic behaviour, and with interference in perception.
Yeah, but again, that is quite common. Most of the clients I see with schizophrenia, those types of problems, these sorts of things are quite common. That was kind of why I'd sort of written the book and dictated some of that in the book as well, really, because I've noticed that these traits, with these types of energies, the traits seem to be quite common. They seem to work in the same way. So it's almost like they know exactly how the human anatomy works, and they have a particular set way of, once they've connected and they've actually got their connections in place, they seem to put these etheric helmets and these other things in place, which then gives them access to effectively like a remote control system, I guess, really. Okay.
So, having conducted your scan and identified in broad terms what you think the problem is, what would you suggest is a way forward in helping this person be relieved of these problems?
I can remove all those things that I've seen, so I can detach the two energies that are connected, and obviously take out the thing that's in the mouth, also the thing that's in the womb area, and basically remove this etheric helmet. And that should then take her back to being, because basically the other thing I do is check sovereignty. So I run like a meditation class on Tuesdays, and we go through the whole concept of sovereignty, meaning are you just yourself, or have you got something else connected to you? So in in my mind, before I start the work myself, I basically check with myself that I'm sovereign. So I ask myself 3 times, am I sovereign? I get an answer back, says yes. Am I sovereign? Answer back, yes. Am I sovereign? Answer back, yes. Now, I don't know where that answer comes, whether it's from my higher self or from my guide or just questioning my own self, but it seems to work for me, really. So that's kind of what I teach in the meditation group. So when I check someone, the first thing I do is check their sovereignty. So when I ask myself, is this client sovereign? The first answer was no. So immediately I knew there was something else attached to that person that's obviously not positive. So once I've kind of been through and removed all of the things that I see, then I go back and check. You know, is the client sovereign? Is the client sovereign? Is the client sovereign? When I get 3 yeses back, I know that person then doesn't have any attachments, and they're back to being just their energetic selves, if you like. And then I normally check their property and make sure there's nothing negative in the property that then reconnects. Because obviously sometimes with sort of clients, if they go back and do, I've checked them and they're okay from a sovereignty aspect. If they then go home and go out and start doing drugs and all that kind of stuff, which some of them do, they end up with more attachments 2 or 3 weeks later, and then they come back to me and say, something's back, but it's normally something different than what was there before.
Okay.
So it's almost like their auric protection doesn't actually protect them in the way that ours does.
Well, their own behaviour is causing problems and attracting the negative energies, isn't it?
Exactly, yeah.
I don't think we're going to have a problem with this case because this young woman is highly intelligent. She's working, and she doesn't get involved in destructive behaviours at all. So, if you feel that you can proceed now with the removal of these energies, then you're invited to go ahead.
Yeah, that's cool. If you just give me a couple of minutes, I'll just go through and do the same thing and call you back.
Oh, yeah, that's fine. That's lovely. Thanks a lot, Andy. I'll wait for your call.